Hi friends, good evening and welcome to my channel Mogambika Nursing. Friends, today in this video we can discuss questions from pharmacology. First question, the most important nursing intervention on a patient receiving prednisolone is options. Option A, checking urine output hourly. Option B, check blood sugar hourly. Option C, check hourly urine specific gravity. And option D, none of this. Here the question is, a patient is getting or patient is receiving prednisolone. Prednisolone is a steroid medication. It is a corticosteroid. So here what is the main nursing intervention? Prednisolone is an anti-inflammatory or immunosuppressive drug. If the patient is taking steroid continuously, patient may experience short-term and long-term complication. If they are taking continuously means long-term complication will occur for the patient. We can see the short-term side effect of steroid. First one, sodium retention, and second one, hypertension, and next one, weight gain, then hyperglycemia. Hyperglycemia means increased blood sugar level, and hypokalemia, GI upset, gastrointestinal upset, and mood changes. Okay, this is all the short-term side effect of steroid, and long-term side effect of steroids include cataract, glaucoma, osteoporosis, impotence, hirsutism. Hirsutism means excessive hair growth in females, and also immunosuppression. So that is the long-term side effect of steroid. Here in our question, most important nursing intervention on a patient receiving prednisolone. Okay, so we discussed in the short-term side effect of prednisolone include hyperglycemia. So we have to check the blood sugar hourly. Among this option, that is the correct answer. Sometimes question can come like this, which lab test should monitor for the patient receiving prednisolone? Then the correct answer will go blood sugar level. Okay, here question is in different way, that is check blood sugar hourly. Move on to the next question. Among the following, which is the long-term effect of steroid therapy? Options. Option A, hypoglycemia. Option B, hair loss. Option C, loss of weight. Option D, steroid psychosis. If the patient is taking steroid continuously, then the patient may experience long-term side effect. Here one of the long-term side effect is steroid psychosis. The patient may experience mild euphoria. Euphoria means elevated mood, also mania, hallucination, insomnia, and violent behavior. These all the effect of long-term use of steroid. So here answer is steroid psychosis. Option D is the correct answer. Move on to the next question. Ephedrine is used in which disorder? Options. Option A, in asthma. Option B, in angina. Option C, in pneumonia. Option D, in heart failure. Ephedrine is an adrenergic drug. That is, it acts like sympathomimetic. That is, it mimic like sympathetic drug. So ephedrine is an adrenergic drug. Its main function is a bronchodilator. It is a bronchodilator. So this bronchodilator is used for the treatment of bronchial asthma. So correct answer is in asthma. Move on to the next question. Drug used in the treatment of migraine is options. Option A, ergotamine. Option B, histamine. Option C, mefensin. Option D, baclofen. And the correct answer is option A, ergotamine. The drug which is used for the treatment of migraine is ergotamine. Move on to the next question. Substance that neutralize bad odor is called. Options. Option A, antiseptic. Option B, deodorant. Option C, detergent. Option D, germicide. Substance, any substance which helps to neutralize or which help to reduce the bad odor of body is called deodorant. Option B is the correct answer. Move on to the next question. First drug of choice to treat an anaphylactic reaction is options. Option A, antihistamine. Option B, corticosteroid. Option C, epinephrine. Option D, bronchodilator. Question. First line drug or drug of choice for the treatment of anaphylactic reaction. Anaphylactic reaction means it's an allergic reaction. And the correct answer is option C, epinephrine. Epinephrine or adrenaline. Okay, in option adrenaline is there, then that is the correct answer. So the injection epinephrine or adrenaline 1 mg per ml. Per ml 1 mg. For that dose for adult it is 0.2 to 0.5 mg at a time. Okay, 0.2 to 0.5 mg. And for children's 0.01 mg per kilogram body weight. Suppose if the child is having 10 kg weight means 0.1 mg. Okay, so the normal dose is 0.01 mg per kilogram body weight in case of children, and maximum children can receive up to 0.3 mg at a time. Here in this question, correct answer is epinephrine, option C. Move on to the next question. Which of the following drug is not used in the management of hypersensitivity reaction? Options: option A, antihistamine, option B, epinephrine, option C, corticosteroid, option D, chloroquine. So which drug is not used in allergic reaction? That is the question. So the correct answer is it is chloroquine. Chloroquine is used for the treatment of malaria. Remaining antihistamine, epinephrine or adrenaline and corticosteroid all we can use for allergy or hypersensitivity reaction. Move on to the next question. Diuretics are given at what time? Options: option A morning, option B afternoon, option C evening, option D night. Question is, at what time we can safely give the diuretics? Diuretics means the drug which helps to reduce the body fluid. So after giving diuretics, the patient may experience frequency of urination. So we should instruct the patient to take diuretic medication at morning time. Thereby we can avoid, if the patient is taking at night diuretics at night means patient may experience nocturia, that is urination at night. So we can prevent that. We have to advise the patient to take medication at morning time. And also we should advise the patient to take medication along with food. This will mainly help to reduce stomach upset. Move on to the next question. All of the following are monitored by a nurse when the patient is on diuretics except options: option A assessing weight, option B restoring fluid intake, option C maintaining intake and output, option D monitoring vital signs. Question is, which among the following is not a necessary thing to assess while the patient is on diuretic therapy? And the correct answer is restoring fluid intake. Remaining, first option assessing the weight. Mainly the diuretics helps to reduce the body fluid. So we have to check the patient. It is a necessary thing. And maintain intake and output. That also we have to monitor. Okay, intake and output. How much the patient took and how much water or how much urine is excreted, that also we have to monitor, and monitor the vital signs also. But restoring or replacing the fluid is not a necessary thing. So we should not assess restoring fluid intake. Option B is the correct answer. Move on to the next question. Which among the following is nephrotoxic? Options: option A diuretics, option B ACE inhibitors, option C NSAIDs, option D sodium bicarbonate. Question: which drug is toxic to kidney? And the correct answer is option B ACE inhibitors. ACE inhibitors means angiotensin converting enzyme inhibitors. Some examples are enalapril, captopril, fosinopril are some examples for ACE inhibitors. This medication ACE inhibitors can cause acute renal failure. So the drug which is toxic to kidney is ACE inhibitors. And when we are withdrawing this drug from the patient, then the patient will come in normal stage. Okay, this is reversible after withdrawal of the drug. So the drug which is toxic to kidney is ACE inhibitors. Move on to the next question. Furosemide is act on which part of the nephron? Options: Option A, proximal tubules. Option B, ascending limb of Lupus-Henle. Option C, descending limb of Lupus-Henle. And option D, distal tubules. And the correct answer is, it is option B, ascending limb of Lupus-Henle. Furosemide is an example of loop diuretics. Diuretics usually helps to reduce the fluid retention in the body. Also helps to reduce swelling or edema in body. Okay, this furosemide is act on ascending limb of Lupus-Henle. Move on to the next question. These all are previous year question. That's why I selected related same like questions. Okay, a patient with renal failure having edema is most likely to receive options: Option A, laxative. Option B, beta blockers. Option C, diuretics. Option D, all of this. Here the correct answer is option C, diuretics. Here question: patient with renal failure having edema. Diuretics are mainly given to reduce body edema and also to reduce retention of body fluids. Okay, so patient with renal failure having edema is most likely to receive diuretics. Move on to the next question. A drug of choice for otitis media is options. Option A, ceftriaxone. Option B, amoxicillin. Option C, metronidazole. Option D, penicillin. Question: drug of choice for otitis media is amoxicillin. Option B is the correct answer. Otitis media means inflammation of the middle ear. First option, ceftriaxone. It is one of the drug of choice of pelvic inflammatory disease. PID, pelvic inflammatory disease. And option C, metronidazole. It is the drug of choice of bacterial vaginosis and trichomoniasis. And last option, penicillin. Penicillin is the drug of choice for anthrax, leptospirosis, actinomycosis, syphilis. All drug of choice is penicillin. Move on to the next question. Drug of choice for a relapsing fever is options. Option A, ceftriaxone. Option B, amoxicillin. Option C, tetracycline. Option D, penicillin. Drug of choice for a relapsing fever. A relapsing fever is a type of fever which is caused by spirochete which belong to Borrelia species. And the drug of choice is tetracycline. Remaining options, ceftriaxone, amoxicillin, penicillin, we discussed in the previous question. So here correct answer is tetracycline. The next question, drug of choice for neonatal herpes simplex is options. Option A, ceftriaxone. Option B, amoxicillin. Option C, chloroquine. Option D, acyclovir. Neonatal herpes simplex, it is a viral infection, so we can guess it. What is the correct answer? Acyclovir, viral infection. The drug of choice is acyclovir. Neonatal herpes simplex, the drug of choice is option D. Today we discuss questions from pharmacology. Again, continuous questions we can see in the next video. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle.